Today's medical-centric topic is skin under your fingernail. What is hyponychium? The hyponychium is the skin under the free edge of your nail, located just beyond the distal end of your nail bed around your fingertip. The hyponychium acts as a barrier from germs and debris, stopping external substances from getting under your nail. Sometimes the hyponychium overgrows and becomes thicker, making it quite painful to trim your nails. Hyponychium thickening symptoms. Hyponychium thickening can affect one, more, or all the fingers. The possible symptoms are tenderness, thick, pale skin under the nail, and pain, especially while trimming your nails. Causes of hyponychium overgrowth. There are a lot of possible reasons why skin grows under the fingernail. You can find out the cause by considering other symptoms and general nail care habits. Pterygium, Inversum, Unguis, PUI. This condition occurs when the hyponychium attaches to the underside of the nail as it grows. Although the condition is uncommon, it causes the skin to grow under the fingernail. The acquired form is associated with contact dermatitis, injury or trauma to the nail, using nail gardeners, frequent gel manicures, wearing acrylic nails for long periods, and nail biting. Acquired PIU can also be seen in conditions like systemic sclerosis, stroke, Hansen's disease, leprosy, subfungal exostosis, and neurofibromatosis. Psoriasis. Psoriasis occurs when the skin cells grow too quickly, and nail psoriasis occurs in many parts of the nail, like the hyponychium and nail bed. It affects any part of the body, including the nails. The skin cells grow excessively, leading to scaling and buildup. This overgrowth is known as subfungal hyperkeratosis. The skin underneath the nail might look chalky, thick, and discolored. When the skin becomes very thick, it causes onycholysis, which is the separation of the nail plate from the nail bed. Fungal infection. Fungal nail infection is another possible cause. It is also known as onychomycosis. It occurs when a fungus on the skin infects the fingernail. It causes both the nail and skin tissue beneath the nail to thicken. Other symptoms include brittle, coarse nails, deformed nail shape, white or yellow-brownish discoloration, pits or indentations on the nails. How to treat it? The most suitable treatment for the condition depends on the cause. Treatment may include 1. Avoiding certain manicures like gel manicures or acrylic nails that cause PIU. You can switch to regular manicures. Corticosteroids. If you have nail psoriasis, your doctor can prescribe a topical corticosteroid. This treatment helps to manage skin thickening. 3. Antifungal medication. Antifungal medication can help treat the fungal infection causing thick skin under the nail. Typically, oral medicine is the most effective, but it has its side effects. 4. Cuticle oil. You can apply cuticle oil to try to soften the thickened skin. When to see a doctor. If you're unsure about the cause of the skin growth under your nail, visit a dermatologist. They determine the best treatment by examining your nails and other symptoms. You should see a doctor if your skin is bleeding, smelly, painful, discolored, and swollen. Make sure you consult a doctor instead of a nail technician, as nail technicians aren't medically trained to treat nail conditions.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.